Good evening, everybody. Can you all hear me? Thank you for coming out on this cold evening. I'm freezing up here. So I'm going to talk to you about health information on the internet and what I mean by a consumer approach. So this is a little bit of the background detail to what I'm going to talk about tonight, give you some background on what I mean by consumer health information and using a consumer approach. Want to talk a little bit about evaluating internet health sites and what to look out for. And what I'm hoping to look at is, a body of health information sites to kind of look at where you won't really need to use a search engine. And there's a continuum of health information, so I'll be looking a little bit, very briefly, at research level health information, which is also available to the public, and then a little bit about search engines right at the end. The standard disclaimer, and these guys and girls are your healthcare providers, and they are the number one. Study after study shows that they're still the number one source of health information. So I would encourage you, despite what you might hear tonight, to always talk to your healthcare provider. As I said just a minute ago, what I'm hoping to do is I'm assuming minimal knowledge of the subject matter. I'm not assuming that everybody's an internet expert or a health information expert. So I'm coming at this from a browsing approach as opposed to searching, hoping to show you that you don't really need to use a search engine to find really good health information. So that's what we're going to do. A little background, and just to put this in context, this subject is really not new. If you look at the literature, the concept of consumer health dates back to 1971. Consumer health information services predate the internet, and they're often provided in large hospital settings, community settings, particularly in the States, also in Australia, increasingly in the UK, and I don't know about Ireland. We'll come back to that question. Also, health information on the internet is not new. For those of you who may remember Gopher, there was information being put up on Gophers when Gopher predated the World Wide Web as we know it now. So it's been around pushing 20 years. And almost as soon as we have had health information on the internet, we've had people tracking the use of consumers and what they use the internet to find, and health information on the internet. So this is really not a new subject. The nuance around consumer health information and patient education and health promotion. Usually consumer health information is defined as any information that enables individuals to understand their health and make informed healthcare decisions for themselves and their families. So it's really starting from the point of view that you take control of finding what you want to find out. It's not patient education, whereas you're being educated about what you might need to know to manage a condition, and it's not health promotion in terms of changing an activity or a behavior around health. So it's very much a consumer oriented, it starts with you and what you want to know. The background, again, increasingly, it's the context for consumer health information, access to health information is around patients being involved in managing their own healthcare, making informed decisions about their own healthcare. In Ireland, there's been very little about consumer health information and consumer health services. There's a 1999 report, I think that was the first one, that talked about community access to health information. And then the Health Research Board in 2009, that study that you see, that's the front cover of it stuck up there. You can see that they said there's a need to increase the awareness of the benefits of using this medium, either for health or wellness or for information on specific illnesses. They found in particular that people with disabilities and chronic illnesses and with mental health issues were using the internet a lot in terms of looking for support. There's a plethora of policy documents that talk about patients and involving consumers in health and having access to information, and again about making their own healthcare decisions. And the latest one, just published a couple of weeks ago, last month, is the Future Health, and it talks about empowerment and the sharing of information. You'll see there the empowerment. The system should empower and support citizens, patients, and healthcare workers to make evidence-informed decisions through appropriate sharing of knowledge and information. So basically, there's a lot out there that says, the internet has great potential as an educational medium. It's a great empowerment tool, but a few issues with it. One of them, these are just some of them, one of them is and this was identified in the Health Research Board report as well, was access and the digital divide. Not everybody has access to the internet. Not everybody has access to the same kind of internet. Not everybody has access to broadband. People they don't have access, they may have access in homes, they may not have access in their home, they may need to go to public library to actually get access to the internet. So there's a digital divide there. There's questions around literacy. I don't know if you are familiar with the National Adult Literacy Association say that there's 1 in 4 adults in Ireland who are functionally illiterate. That's a huge, huge number. And if you look at health literacy, and I'm going to quote this because I can never remember the definition. Health literacy, the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. There's an issue around that. There was 2 studies published just this year from researchers in Cork. One of them says inadequate health literacy is at epidemic levels in Ireland and is fast becoming recognised as a national issue. The other one said 1 in 7 are found to have limited health literacy, which may affect their ability to promote, protect, and manage their health. So that's an issue. This one was a new one on me, e-health literacy, which translates that health literacy concept into the electronic environment and basically says you need to be able to find, understand, and appraise the health information and be able to make an informed decision. Language is an obvious one in our diverse culture. Increasingly, we have people for whom English is not their first language. And there's relatively few Irish health sites that provide information in languages other than English. Quality. The quality of information on the internet has been a huge issue right from the start. As soon as there is health information on the internet, there is articles and research about the quality of health information on the internet, and that they date back again to the mid-1990s. They're usually topic-based, so you'll find articles and reports or research done on the quality of information related to breast cancer information on websites. And there was the most recent one actually, again done by researchers in Cork in 2012. The first Irish evaluation of websites was done, I think, in 1999. Huge quality issues. And again, the Health Research Board report highlighted again that quality of information on the internet is a massive issue. The social media, again, this could be a completely separate topic. And I love this quote. Basically, I know and I want to share my knowledge is the leading edge of healthcare. And what they mean by that is kind of user-generated information. With the access to social media tools and people getting online and forming communities around different topics, people are generating their own information. They're sharing their experiences of their health condition or their treatment or whatever, and that's what that means. Again, you're starting to see research around the use of social networks or online social media tools, both as an educational opportunity, but also, again, the issue around quality and the quality of and the veracity of information that's generated in that way. The idea of the continuum of information, the health information on the internet, goes from the very basic right up to the research level, and again, to have an understanding that there is that scope for it. So, what do we know about people looking for information on the internet? We know quite a bit, actually. Well, we know from the American side, so we kind of probably translate and see does that apply here as well. The Pew Internet and American Life project has been tracking the use of the internet in American life for around the last 10 years, maybe slightly longer. And they look at lots of aspects of the internet in American life, but they also look at one of the issues is health, and what do people use the internet for when they're looking for health. They've found that over the years, these have remained fairly stable. I don't know whether you can see that. They changed the topics that they ask people. Do you look for this or do you look for that? But the one thing that has remained really constant is people look for specific disease or medical problem. They look for information about specific disease or medical problem, and they look for medical treatment or procedures. You can see that changes slightly every year, but they're pretty, what people look for pretty much stays the same. There was a survey by the Irish Pharmacy Union earlier this year that found about 40% of Irish people looked up medical conditions on the internet in Ireland. So that's the background. You see, it's I'm going to tell you what I mean by a consumer approach in practice. Basically, this is common sense, and this comes down to know what you're looking for and know what to look out for. So if you're starting to look for information, this is going to sound dead obvious to people with common sense. What exactly are you looking for? And that sounds like a very simple question, but you know, if you can define what you're looking for, if you're looking for information about a condition, what do you want to know about it? Do you want to know what it is? Do you want to know what is treated? Do you want to know what the prognosis is? If you want to know how it's treated, what kind of treatment are you looking for? Are you looking for drug therapy? Are you looking for surgical? Are you looking for physio? Are you looking for alternative treatments? If you're looking for drug information, what specifically do you want to know about the drug treatment? Do you want to know about a specific drug? Do you want to know the side effects? You know, just focus in on exactly what you're looking for. You might also want to consider how much you really want to know. Do you want just an answer to a basic question, in which case you might be better off asking your healthcare provider? Do you want to go the full whack and look at the research literature? So how much do you want to know? And again, at what level? That goes, you know, you're looking for information that's, is it for yourself? Is it for somebody else? Does it have to be very simply written? Again, does it need to be at the research level? And then ask, where am I most likely to find this? And don't rush straight to Google. I think that's where people are going a little astray. You don't need to rush straight to Google. One of the things I found when working with people who were looking for health information, and I did a lot of this in the States, so this is my way of keeping up to date, is that they can't remember what their physician said. So if the physician has given you a diagnosis, and one of the things I would actually say to you is never go looking for health information unless you have something specific to look up. So you shouldn't be looking up signs or symptoms. You should be probably looking after you've got a diagnosis, you know what you're looking for. And if you can't remember what they say, write it down. The spelling makes a huge difference. And if you see up, I think if you can see up there, the American versus the UK spelling, and you can see the difference in retrieval. The American spelling of pediatric retrieves 92 million hits on Google versus 13.8 million the UK spelling of pediatric. Ditto for esophagus. You know, you have 11.4 million hits, the American spelling, and 2.45 million with the UK spelling. And just as a matter of aside, 3 years ago when I did this, I looked up pediatric, and I had something like 30 million hits for the American pediatric spelling and 3 million for the UK. So even that shows you the kind of the volume increase of information on the internet just in that time period. It's easy to get muddled up with words as well. You know, we've got the diverticulitis or diverticulosis. You know, it's easy to get muddled up with that. People confuse hyper and hypo. And people say, sounds like this. Was it Zenkums or Jenkins or Denkums? You know, again, be very clear about what you're looking up. My best advice is never to go looking for signs and symptoms in a search engine or in general. We actually tell medical students never to look for signs and symptoms when using the biomedical databases. So the same applies to everybody else. Okay, I want to move on to evaluating health websites and the idea of what you need to look out for. You know, again, the idea is, you know, if you're an informed consumer, you need to watch out for a few things. And just because it's popular doesn't mean it's quality, good quality, or that it's reliable. Sometimes websites are the only one of their kind, and that just doesn't mean they're any good. So, some questions to bear in mind, looking at provider and the purpose. Simple questions, and these will sound like common sense when you actually think about them. Who's running the site? There's a big difference between an individual, an interested individual running the site, and somebody who's a world-class or a first-class expert in their field. What's the purpose of the site? Is it educational, or is it trying to sell you something? What do they want from you? Do they want anything from you? Do they want you to register? Why would they want you to register? Do they want your details? who's paying for or sponsoring the sites, and that could be a flag for, bias. There's information, we always use the example of drug companies putting out information, is that bias? But you can equally look at that site up there, the Juice Feast site, which is a weird and wonderful site put out by a couple of individuals who are promulgating the benefits of feasting on juice as a cure for all sorts of chronic conditions. So ask those questions about provider and purpose. The quality of information, how do you tell the quality of information? You look at where is it coming from? Who's actually providing that information? Is it being authored by healthcare professionals, or is it being authored by interested individuals? Big difference. Is it reviewed by experts? It should be. Does it make unbelievable claims? And I would caution, any site that's advocating a cure is a site to be avoided. And I'll give you an example. There's a woman called Dr. Hilda Clark. She died a few years ago, but Dr. Hilda has a fascinating website where she sells zappers to avoid or to eliminate small invaders such as parasites, bacteria, and viruses. So it's just bizarre information, very easy to go astray. Is the site up to date? There should always be a date on it, when the information was last updated. Is it easy to use? Is it easy to read? If it's using technical jargon and highfalutin language and you can't understand it, it's probably not a good site. And is the information applicable to Ireland? This particularly applies to drug information and some services. It may or may not be available in Ireland or may not be regulated in Ireland. You'll see that's the editorial policy from the Irish Health, irishhealth.com site. You can see that they have experts reviewing their videos. So you can look for named sources. Privacy, again, the questions to ask. Do they want your personal details? What do they want them for? What will they do with them? Is there a privacy statement? There should always be contact information. You should be able to get hold of a person, or you either need a phone number or an address, preferably both. You'll see that's the HSE privacy statement. It tells you what they do with the information that you may or may not provide, and what they will do if they change their policy. So you should look for that kind of information. So having gone through that, what you need to look for, where should we begin? I'm advocating directories, and I call them the directories because I don't really know what else to call them. And I'm wondering, is the concept of directory almost defunct? Some of us are familiar with telephone directories, but that concept is rapidly disappearing. Why start with these? They're usually large sites, they have a lot of content, they're long established. The best ones have been around for at least 10 years and more. So they're coming from an authoritative base. They usually lead you to other resources that are equally authoritative. They're easy to use. So it's efficient use of your time to go to these large sites. So start off with these large sites that cover a lot of in-depth information. And the purpose is usually to educate and inform. They're not selling you anything. So we typically include all of these kind of resources, dictionaries, encyclopedias. There's an A to Z topic list usually. There's often videos, surgical videos are popular, health news, and interactive tools. So they have a lot of things going on for them. So I'm going to show you a couple of these, and we're going to look at those kind of criteria about quality. This one is Medline Plus. It's one of the oldest out there. It's from the National Library of Medicine in the US. National Library of Medicine is one of the National Institutes of Health. And it was actually started because they found so many consumers were trying to use the Pubmed database. So they thought they better start providing information for consumers. As you can see, I'm in the health topics piece of it. There's different access routes to it. So you can go through go through the A to Z, looking up what you want. You can go through the body system. You can just look under diseases and disorders and conditions. You can just go for diagnosis and therapies. You can go by your demographic group. So there's different access routes to that information. If you go into any of the health topics, there's a standard presentation of the information. And they go from the basics in terms of saying what this is, how it's diagnosed, how it's treated, what the prognosis is, right up to research level information, what the current research is, where you can get further information. There's lots of cross-references and pulling of information from lots of different sources. So, you know, they would pull things from, say, the Mayo Clinic or the Cleveland Clinic or from the UK, the Cochrane database. So there's no need for you to go to those separate sites. It's all in this site. I do want to look, if we look at those criteria, you'll look at there and you'll see they have the About section. So any details that you want to know about the, where this information is coming from, who's put it out there, is usually under the About section. If you look down the bottom, you'll see they have the disclaimers, the privacy statement, the accessibility, they have quality guidelines. So you can see how they actually come at this information, how it's reviewed, who's reviewing it, and they have their address there. One of the best things about this site is the multiple languages. I think there's about 40 plus different languages that they provide information in. Not every piece of information is in another language, but if you go onto the front page, you'll find you can click on multiple languages and you can pull out a language and see what they have available in that language. So it's brilliant from that perspective. This is just one of the American sites. The National Institutes of Health itself has another one for consumers, and there's another one by the US Department of Social Services. And I'm emphasizing the States because they do it really well. So that's Medline Plus. This one is from the NHS, and it's the single point of health information in the UK. It's a massive site. Again, I'm in the Health A to Z, and you can see, similar to Medline Plus, you have different access routes to this. You can go the A to Z route and pick out your alphabetical listing, or you can go through the anatomical figures there, or you can go down by common conditions. There's 20,000 articles in this site that are regularly updated. It's absolutely massive, and this is a page crop. One of the things I like about this is the health news. So you read the headlines that say, you know, broccoli cures bladder cancer, and they explain the science behind that, which is really, really helpful. Again, standard presentation of information and lots of cross-references to other sources of information. It's a really good site. It's useful to remember. It's not an Irish site, even though it's so close next door. And a lot of the referrals they're doing are to healthcare professionals and services in the UK. But for information, it's bang on. Now we come to the, this is the best of the Irish equivalent of those mega sites or directory type sites that I'm aware of, irishhealth.com. And straight away, you'll look at this and you'll notice the difference. It's got a completely different look and feel about it. And one of the things you notice first of all, advertising. We have advertising on here. This is really a medical news, medical journalism site. So while they do have information, they have health topics. I looked at the health topics. They are presented in a standard format, but I found the date on them. They were either very old or there was no date. So you'd have mixed, you know, I wouldn't be looking there, first of all. One of the most useful things on this site, I think, is the patient support groups and the links to health sites in Ireland. The downloadable health resources are also a bit dated. They seem to date from 2003, 2004. So while it's there, it's not, I don't think it's as good as the UK or the American ones. We look at the HSE. The HSE provides a lot of information on its site. Its primary focus is health promotion. So while they do have an A to Z list on their front page, it's the site map. It's not an A to Z list of health conditions or health topics. So this is slightly different. It's also a little difficult to navigate. If you're looking for cancer information or about cancer, would you be looking under your health or would you be looking under service? It's actually under a service. I don't think that's intuitive. There's also information right at the top, right up here on the links, which links to other sources of information. So the information content, while it's pretty good, is actually spread out. It's not that easy to find. They have a range of different sites for different conditions and different health topics. And the healthpromotion.ie site is probably one of the better routes to go for access to that. And again, the healthpromotion.ie site has a few publications in different languages. I want to look at specific topics and the type of topics that people often ask about. So if we start with services and entitlements, this is the Citizens Information Board, and this is their health section. This is the top level. So if you go into any of these sections, you'll get another list and another list. This is where the Department of Health and Children link to. So rather than provide their own information, they leave that to the Citizens Information Board. The information here is actually very good. It's bang up to date. It's presented in a standardized format. It's easy to read, it's easy to use, and again, it cross-references you to other services and health information. The language part of this, you see they have a language up there and it says Gaelic, but if you are on the front page, you can actually pull up and see what other information they have in different languages, and they provide some documents in Polish, Romanian, and French, so there is some substance there. If you're looking for a specific, if you're looking for information on a specific condition, I guess this is just a kind of a strategy approach to looking for it. The first thing you should do, maybe check out an Irish organisation. So if you're looking for information on cancer, the obvious place to start would be the Irish Cancer Society, and we could go to the HSE and the Cancer Services section. You use those directory sites, those large directory sites. They'll lead you to more specialist sites, and some of those are listed down there, the Macmillan Cancer Care and the US National Cancer Institute, and Oncolink. Oncolink from the University of Pennsylvania is probably the oldest cancer information site in the world, established around 1993, which is a dinosaur in internet terms. So that's a very general strategy to adopt if you're looking for information on any health topic. I put up support. Again, I'm going to leave there's a document that I'll put up on the website which has these website addresses. But again, you can see there's quite a lot of information from Ireland on support. It seems to be something that we do pretty well. There's lots of voluntary organisations, lots of charitable organisations that provide information and support around various health matters. So the patient support groups and the links to health sites on that irishhealth.com are to be recommended there. There's Mental Health Ireland. There's disabilities from the Active Link directory, and that's actually a huge community-based resource, not just for disabilities. And rare disorders, the European site that you see up there, Eurodis, is the European support site for rare disorders. And NORD, which is the National Organization for Rare Diseases and Disorders in the US, is their rare disorders are by their nature very rare, so in terms of support, these are excellent sites. This is a use of the social media we were talking about earlier, and this is referred to in the UK Choices site. It's Health Unlocked. There's 150 communities on this site, and again, it's the user-generated type. You can ask a question, you can find out from your fellow or your peers, people who have the same condition. You can cross-check and ask questions. Each of these communities has a blog and a poll type thing and the questions. You don't need to register to actually use or view the questions or read the blog. But if you want to ask a question, you actually have to join. I found it a very simple, really easy site to use. They have all their terms and conditions, their policies, their privacy statements, their disclaimers, and they're monitored and mediated by patient groups and charities, so it's not just a free-for-all. And if you want to see it in use, if you go back to the NHS Choices site and look under the acne, you can see how the skin condition community is integrated into the Choices site. So it's recommended by the NHS. Complementary and alternative medicine is a really hot topic. People are always looking for information about that. If you're looking for evidence-based information, this is the National Centre for Complementary and Alternative Medicine. Again, it's the National Institute of Health from the US. And the A to Z index which is highlighted there, is the evidence-based information on treatments and conditions. So you can go in there and look up anything from green tea to tai chi. They give you information on complementary and alternative treatments for colds and flu. And those of you who are maybe fans of echinacea may be disappointed to know that there's no evidence to say that it helps colds whatsoever. So again, it's a huge site, and again, it goes from consumer level information up to research level. Tests, people are always looking for information about tests, and this is lab tests online. There is an Irish version of this, but it links to the UK version, so I might as well show you this. Again, it's written with a patient in mind, and the access route are those three menus on the right-hand side over there. You can either go through tests or conditions or through screening. It's written at a level that patients and consumers are meant to engage with. Very simple explanation around conditions and the tests and what the test results mean. Gives you all the reference values so you can see where you lie and all that. I have had occasion to use that and find it really useful. So, drug information in Ireland, I mean, you see lots of drug information out there, but this is where we should be going for drug information on Ireland, what's approved and regulated for Ireland. Provided by the Irish Pharmaceutical Healthcare Association. It'll either give you the patient information leaflets or a summary of the product characteristics. Again, you can browse it or you can search it. As with all the sites I've been showing you, you can just browse them. You don't need to search them. You can search them if you want, but you can browse them. And if you don't like searching or you're afraid of missing anything, the browsing approach works really well. And as consumers, sometimes you'll want to make a complaint. So here's Health Complaints Ireland. It was information on how to make a complaint or give feedback about health or social care services in Ireland. Pulled together by the Office of the Ombudsman, and it involved all the professional, regulatory and accreditation bodies. You can complain about anything from ambulances to doctors, to nurses, to speech language therapists. It tells you how to complain literally from any aspect of the healthcare system in the country. It's a fairly new site, I think, as well. Before I move on to the research level stuff, I just want to draw people's attention to the Public Libraries Initiative and something called bibliotherapy or healthy reading. And there's some evidence about the efficacy of book reading or being prescribed a book to read for minor or moderate psychological or mental health problems. The one on the, what's that, your right, which is the North Inner City Book Prescription Project, is probably one of the first, it was the first in the country. It's a partnership between the GPs and the HSE and the Dublin City Public Libraries, where doctors can prescribe reading material to patients. They go to the public library, they'll get the book. There's currently, I think, about 35 titles on those leaflets, and you can go to the Dublin City website, the addresses are there, and you can find the reading material recommended for that. So that's another aspect of consumer access to consumer health information. I'm going to move on to research level information, and I'm not going to spend a lot of time on this. It's just a really brief overview. We'd start off by saying if you want to access the research level information, an understanding of the literature and the language used in research level information would be essential. So, it's basically around evidence-based healthcare. Need to know about different study types and methodologies, the concepts of critical appraisal and risk, systematic reviews of the highest form of evidence. You can inform practice guidelines. Practice guidelines are what guides clinicians in how they treat patients. There's a difference between the biomedical literature and the nursing literature. The biomedical literature is obviously, it's the high end, and it's easier to access in some respects in that you can see the abstracts online. The nursing literature is probably easier to read for consumers, but it's very difficult to get access to the nursing literature unless you're actually in an academic environment or a healthcare environment. And I think the question of access to information in general, but particularly the research level information, health information, is a key question. So in terms of what you do have access to, and again, coming from an evidence-based approach, we're going back to the NHS, and this is the evidence from NHS. Not all of this is accessible as is up there. Particularly the journals and databases are just not accessible to anyone in Ireland. They're meant for UK healthcare providers. But again, the A to Z topic list of evidence for what's the best evidence for treating particular conditions and what's the evidence about medicines and drugs. It's all on that piece there. Again, I said I'm going through this very quickly. Pubmed Health, again, this is fairly new site, clinical effectiveness. Again, if you use that drop-down menu and look for the consumers, it's a huge amount of information, again, in terms of what is clinically effective, what's the evidence for why they do what they do. And you'll see the information sources along the side there. These are the evidence. There is no reason to go anywhere else. If they're pulling from all of those sources to provide the information in this one site, there's absolutely no need to go to any of those other sources. This is the highest quality evidence that you're going to find. They have, again, the behind the headlines section similar to the NHS. So you get the headlines like the BBC reported tomatoes are good for strokes. For stroke preventers. So what does that mean? So they provide the science behind that. You can link into understanding the news and what it means when it's reported, and clinical effectiveness, and they'll give you articles to read on what that actually means and how to read the medical literature. The Cochrane Library is the evidence source. If you're doing any kind of research, you'll probably come across the Cochrane Library at some point. This is what it looks like. And I'll talk a little bit about it in a minute. If you want to learn more about it, it has a full section there on how to use it, what it all means. But basically, it's evidence. It's the evidence database. It's a set of databases. The one that most people are interested in is the database of systematic reviews. There's a couple of, well, there's about 6 other databases that go with it. They ask a very specific question, usually with a particular patient population in mind, and they're asking, what does the intervention do? What's the evidence for this intervention? So they can ask anything from, tongue clearance, cleaning your tongue for bad breath, to treatments for glaucoma, alternative treatments for glaucoma. It's free to use in Ireland, courtesy of the Health Research Board actually provides this to Ireland. It's full text, and if you're using it, you look for the plain language summary that comes with the abstract. The caveats are all up there. It can't offer you a treatment, especially if you're a person who differs from those defined in the review. So if they're looking at middle-aged people and you're not in the middle-aged category, what they find won't apply to you. They may consider outcomes other than the ones that you're interested in. They might look at the long-term effects. They might find, you might be looking at studies only in one particular healthcare location, so it might be in a hospital setting, it could be in a community care setting, it could be a primary care setting, so it mightn't be of interest to you in that respect. And people should be aware of the difference between a protocol and a review. A protocol is a plan of a study. It means the research hasn't been done yet. And if you go in there, you'll see them marked as protocol or review. So there's no point looking at the protocol ones unless you're interested in the study methodology. Pubmed is the biomedical literature database, and this has been free on the internet for a long time. Again, it's National Library of Medicine putting this out. It's basically an index to all the biomedical literature. They index about, it says about 5,400 journals, and that's only a subset of the totality of journals that are available. And that seems to be an ever-increasing number. The last time I checked, it was about 13,000, but it would be higher than that probably. Runs from 1948 to present, 37 languages. There's abstracts to most of the articles there, and there's some links to full text. I wouldn't advise anybody to start with it. Again, if you're using something like Medline, Medline Plus, the consumer version of this, they're pulling their information from Pubmed, and they're synthesizing it and rewriting it for consumers. But again, it's what the researchers and the clinicians use. Clinicians less and less, they're more now relying on secondary sources, but that is the primary source. So the question about how do you get access to these resources, and that's again, I think this is where the inequality of access to information comes in. The journal articles, if you do a search on PubMed, the journal articles, you get the abstracts. You get the abstracts free, you can read the abstracts, but the full text of them are generally through subscription only. Now that is changing through the open access movement, where the open access movement is basically, if research is funded by public money, it's becoming increasingly mandated from the funders that the publications or the output from that funded research gets put into an open access repository so that members of the public have access to information that they have funded through their tax, basically. So you'll see PubMed Central and European PubMed Central are open access repositories. So funders with a mandate, and there's a number of health funders, health research funders in Ireland who require researchers to put their published research into open access repository. They'll have to put their research into these open access repositories. Now that's kind of a movement that's taking off, so that it's not completely organized, shall we say. So you have open access repositories like PubMed Central and the European PubMed Central, but you'll also have institutional repositories. So every university in Ireland has its own institutional repository. RCSI has its own research repository, so the output of our researchers are put into that. There comes with some caveats in that the publishers determine what can go into them. So if the publishers say you can't do that, it can't go in, no matter whether it's mandated or not. So, but that, as I said, is an evolving issue. The HealthWell is run by the Institute of Public Health, or the Irish Public Health Institute, and it's an all-Ireland resource against mostly policy documents and evidence-based information to guide practice. From an Irish perspective, that's probably one of the best sources of evidence-based and research-level information. So the question about access to these information, usually you have to have access to a health library, or as I said, either be in the healthcare environment or an academic environment to get access to this kind of information. So I think that's a real issue in terms of equality of access. And as for consumer health information, we don't really have established consumer health information services. I think it's still a concept that's fairly new in Ireland. I hope, having gone through that you can see if you're using a search engine, you're just going to get vast retrieval. You can stick in, it's too easy. It's unfiltered. So there's nobody looking out at that and saying, well, that's good, that's poor quality, we'll ditch that, we're going to include this, we won't include that. It's just totally unfiltered. And I think Mary will be talking to you about self-diagnosis and self-treatment and the issues that arise when people actually do that. Increasingly, Google is explaining how it runs or how search operates. And if you really want to knock yourself out and find out how Google works, there's a site called Inside Search. And they have an education center. So they've got tutorials on there on how to search using Google. They run occasionally power searching classes in using Google. And I think you can see that when you look at that, their little search box looks so deceptively simple. But it's kind of little knowledge is a dangerous thing. So I would hope that we go back to the start, that these people remain the #1 source of health information, and that you will see that using those sites, you may not need to use Google or a search engine at all. All those resources I've shown you I'm going to put them on a separate document on the website, and the reference to some of those studies that I cited will be up there too. So thank you for listening.
Well, I came here because I'm a registered osteopath, and I wanted to do, I have to do 30 hours of continuous professional development, and to stay registered every year. Even though I've taken a year out, I'm doing a bit of teaching at the moment, and to keep up to date on the latest medical developments, so it's an ideal opportunity. This evening was particularly valuable to me, particularly the first lecture on information systems and on searching and researching online, and on the reliable websites to use for medical research and also for public who want to look up conditions and A to Z of conditions. So yeah, I think it's a really good. It was an excellent lecture tonight.
Yeah, if you have any interest in kind of broadening your horizons and just learning, because I even found the talk on the library stuff really, really good, just to know how to make sense of what's online and where to go and where not to go. I thought it was great for general knowledge, and I thought it was aimed at an audience that was ready to think but didn't actually have to come in with degree level, that anybody could access them. I thought it was great.
Absolutely. I think it's quite a big problem in research, in particular actually, that an awful lot of information isn't accessible to the general public, but this is free, it's here, and I felt it was very accessible, and the other talks in the series as well are kind of very, very open, very accessible to the general public.
Oh, I think it's an excellent opportunity for people to come along and just to gain information on various health topics and just treatments and what's happening in medicine in general, and they'll gain a lot of valuable information from it.